is our simulation lab at the Ralph H. Johnson VA Medical Center, and this is our new simulated operating room.
Left hand to help yourself out. Try to find that window.
One of the key features of this is that it houses our DaVinci XI surgical robot and a dual console. It basically simulates an entire operating room setup, has all the necessary equipment. What we're doing here is we're helping transition between a VR simulation platform, which is what we typically use to learn the robotic console, and getting to an operative procedure on a patient by creating these new synthetic models using our 3D printing lab. So this is a big kind of patient safety issue, and to help create that transition for our residents, get them to be able to suture, use the surgical stapler, and get a feel for the tissue, which is different than what they get in a virtual reality setting. What I'm able to do is kind of proctor them and teach them in a low stakes environment that takes the patient care side of things out of the equation in order to help develop their baseline surgical skills. We're working on components of operations and then building up to surgical models in order to simulate operations so that when they're in the OR and on the surgical robot, it's not the first time that they're doing these skills.
Once you pull it through the tissue, you're not going to grab it neutral and then flip through.
It's different because I'm able to feel more like what's on a tissue rather than the simulation. You can't have the same amount of understanding about how the tissue is responding to what you're doing. So this simulates exactly how when I make a move, the tissue responds, whereas on a simulation, I can't tell how much pressure or if I'm hurting tissue or if I'm handling it appropriately. So this is way better.
So we're gonna bring it in. Get the bottom blade.
No longer are you having to just try out your skills using the virtual simulator. You actually get to have real hands-on opportunities to practice some of these techniques that you can't really replicate with just virtual platforms. The partnership between the VA and the MUSC really allows us to get experience to both patient populations as well as both different types of facilities, different cares provided at both places, but the VA is an excellent opportunity to get a really nice general surgery training from hernias to gallbladders, appendixes. We do colon cases here. It's a fantastic all-around experience.
You know, they're taking their training and bringing it to the OR, one, to maximize their learning, and two, to improve patient safety.